Well, good afternoon, everyone. Thank you guys for joining the Linkages collaboration, leveraging CalWORKs for primary prevention via linkages. I see some familiar faces here. It's always good to see you guys. I'll be glad when I see you all in person in April. But before we get started, I want to go over some different terms and definitions, some just basic for those who may not be familiar with linkages. Linkages is a term used by participating California counties to describe the working partnership between CalWORKs and child welfare agencies to collaborate when families are receiving CalWORKs and child welfare services. Linkages case coordination practice has the goal of assisting families to achieve financial self-sufficiency and economic mobility while promoting child safety, permanency, and well-being. For over 20 years, Linkages practice has primarily focused on tertiary prevention for families already involved with child welfare. And next slide, I'm sorry. Today, we're going to talk about where Linkages has been, where Linkages is right now, and where we plan on going in the future. Our presenters today are Juliet Cox, Damian Ladd, Dana Fabella, and myself, Andrea Lewis.
Thanks, Andrea. Thank you so much for starting us off. I was going to ask before we get started, and Andrea had said she sees some familiar faces here in the room. How many folks here are familiar with Linkages and the Linkages program in California? Can you just show me by raising your hand or putting your virtual hand up? It'd be good to get an idea of like if we have folks who are familiar or folks who are hearing this for the first time. Okay, so I see about 10 folks, 12 folks who've raised their hands. Great. Now I want to ask a second question. How many folks here have active linkages programs in their county? Is it the same group of folks? Yeah. Okay, well, we have 54 people here today, and about 10 folks raised their hands. So we have a lot of folks here who potentially are learning about the Linkages program in California for the first time. And we're really happy that you're here with us today so that we can talk to you about how to leverage your CalWORKs and Linkages program specifically in your counties as a primary prevention and secondary prevention program. So thank you again for choosing this. There's a lot of great workshops going on today. So we're glad that you came here to meet with us. My name is Juliet Cox, and I'm the Deputy Executive Director at the Child and Family Policy Institute of California. And I'm very blessed to work with great people here at the organization. And one of them is here with us today and just kind of the godmother of Linkages. She's been around since the beginning of the program. Her name is Dana Fabella. She's our Linkages project coordinator, and she's going to walk us through kind of the history of Linkages in California and how we've gotten to where we are today. So go ahead and take it away, Dana.
Thank you so much. So I really appreciate you all being here, and thank you for that lead-in, Andrea. As you heard her say, we've been doing this about 20 years in California, so we have a lot of history, but we've also evolved as well, and we'll talk a little bit about that. So where have we been? Let me, next slide. The idea for linkages in California really grew out of some work that an organization called the Child Welfare Partnership, the Center for Research on Women and Children. They led this effort in back 1997, and part of it was the interest of what was happening in El Paso, Colorado. They were using TANF dollars at that point in time to really support some of their child welfare families. So we were interested, California were interested in learning more about that. So we did a field trip to we being California, I wasn't part of that, to Colorado to kind of understand what were they doing, how were they using these dollars to support these vulnerable families. And so they came back, the group from both county leaders as well as state leaders came back, and then they developed work groups to build some model protocols where 12 counties stepped forward and said, yeah, we're interested in trying some of those strategies. So that's kind of how we began. Next slide. So the Center for Research on Women and Children in 2005 really asked CFPIC, would you take over this project? They were really more of a policy organization, and they didn't want to be involved as much with actual implementation. That wasn't their area. And for us, we are an organization that really supports implementation at the county level. So we were excited as an organization to have this shift to us, CFPIC. And we were funded for a couple of years by a private foundation to support the work. But when that ran out, we really knew we needed to think about how we were going to support this great work, because we really just got our toe in the water, so to speak. So we applied along with the Department of Social Services, the Office of Child Abuse Prevention. We joined together and submitted a proposal for a federal grant, which we called Linkages, Child Welfare and CalWORKs Collaboration to Improve Outcomes for Children and Families. And when we built that, when we built the current, what we look like today, it's foundational in that federal grant. What we did is we created protocols. We built on protocols. And one of the things we wanted to do is make sure that the outcomes were not just for the child welfare side. We really wanted to think about the partners. If it's a true partner, you really want to have outcomes on both programs. So there was really thinking about how could whatever we did improve the outcomes for families, and the CalWORKs program is too. So during that time, we added more counties, about 17 additional counties. We were up to about 30, I think, at that point under the federal grant. And when the federal grant ran out in about 2012, 2013, we had a little bit of rollover we could work with, as well as we got the Self-Sufficiency Committee of CWDA helped fund us for a year or so, and then we really didn't have any funding. So it kind of ended our support effort. And a lot of counties, though, continued their work on linkages. And fortunately, in 2019, thereabout is when the state, CDSS, looked at linkages as a way to sort of support families and increase the array of services for families through a partnership with CalWORKs to build that partnership. So between 2019 and 2021, there were work groups that under the Center Capacity Building Center for States and CDSS and CFPIC and counties came together to kind of look at what the framework we had under what we call now the Linkages 1.0. And what we thought about, and I'm very glad that the group went that way, is we really thought we need to align linkages as where the field is going, child welfare, as well as where CalWORKs is earlier upstream, because 2.1, the Linkages 1.0, I should say, really focused on families that had abuse and neglect. They were part of the child welfare system, and it was coordinating between the child welfare worker and the CalWORKs staff, and that's still an important strategy in the Linkages project. It's still very important. However, what we did is we moved upstream in terms of looking at how we could be more effective collaborating, not only on a case specific, but on a program, so a system collaboration. So we established work groups, the prevention and early intervention one, which Juliet has been very provided a lot of leadership on that one. Coordinated case planning, we looked at our protocols to see what we needed to enhance. We have an evaluation going on. We've got 3 counties that have agreed to work with us on evaluation, looking at the coordinated case planning piece of linkages, and we also have a transitional age youth work group. So we're continuing to evolve and do work around these different areas. And in 2022, we were really very pleased when the state and CWDA agreed to fund support for the counties, and that through CFPIC's supportive work. So we have we do webinars, we do coordinated we connect counties with their partners. So we do a lot of work. So if you're not part of the collaboration, please put your interest in the chat, and Andrea and I will make sure we get back to you on if you're interested as you hear more about what we're doing. Next slide. I'm turning it back to you, Andrea.
Yes, ma'am. So over the years, we have identified some key ingredients for the success in linkages. Leadership, number one, strong leadership from both CalWORKs and Child Welfare that facilitates a workplace culture that encourages a willingness to try new things. A leadership sharing their belief that families would be better served through CalWORKs Child Welfare collaborations. A leadership building a shared belief in the value of collaboration. Invested and engaged leadership that facilitates and builds solid frameworks for coordination. Policy. Policy at the state level, advocacy for changes in law and policy that supports linkages like AB 1686, AB 429, AB 135, and CalWORKs 2.0. Joint policy at the local level, clear guidance on maximizing available funding like CalFresh, CalAIM, family stabilization, those types of different available funding sources. Clear guidance on implementing program changes like AB 429 and AB 135. Training, cross-training early and often for onboarding and refresher training. Training curriculum development. Accountability, building accountability by asking for regular updates about linkages, being in the know, communicating with your peers, communicating with your supervision team and your leadership team, as well as your families. Working together, coordinated case planning via joint participation in child and family team meetings and joint home visits, joint anything, phone calls, and include everybody in an email, just joint communication. Cross collaboration with other services and systems like your resource navigators, your housing supports, public health, behavioral health, any other supportive systems that are available. Use of shared data systems and shared communication systems. Co-location, putting your employment services with your child welfare or your CalWORKs worker with your child welfare. Being able to be co-located assists with immediate communication and collaboration. Compatible procedures between child welfare and CalWORK staff. Clear communication between child welfare and CalWORK staff. Clear guidance from the state. Joint policy. Clear guidance on information sharing and policy and regulation. Regional and statewide convenings with information about best practices and peer sharing opportunities. Now let's learn more about how income supports and prevention, like Linkages 2.0, can help address disproportionality in the child welfare system. Damien, are you ready?
Born ready. And I was born ready. I think it's something about me. So hi, everybody. It's nice to be here. My name is Damien Ladd. I'm with the Department of Social Services and the CalWORKs program. And I've got over the next some very interesting slides. I think they're really quite interesting slides to go over. The next few slides, I'm going to sort of talk about the intersection between poverty, race, and disproportionality in child welfare involvement. And then as well, kind of cover how prevention can be used to address that issue. So let's go on to the next slide. Okay, so we can start with, and this comes from the 2021 census, that poverty is not evenly distributed across all racial groups. So you can see here that 15.3% of people are living below the poverty line, but how those proportions break down across various racial groups. So you can see there when you look at the numbers, you know, some numbers kind of stand out, like, okay, well, that seems a little bit, you know, a little out of whack, a little overly represented. Okay, let's go on to the next slide. So what causes poverty? Poverty can really be boiled down to sort of three main components. You know, if you were sort of turning it into a math equation, you would say there's three elements in the denominator. There's material hardship, there's parenting challenges, and there's adverse environmental exposures. So those three things work together to increase a state of stress and risk for child maltreatment. Some refer to it as toxic stress, when you're sort of living in a constant state of survival mode. It creates a toxic, stressful situation, which can lead to child maltreatment. Let's go on to the next slide. So here, just to kind of recap what I've said so far, we see that poverty is a risk factor for child maltreatment. Poverty is unevenly distributed across racial groups. Child welfare involvement is similarly unevenly distributed across racial groups. And the kind of good news here is that there is policies and activities that can address poverty and can decrease these disproportionalities, which is what we're working to do. So the next slide, please. Yeah, so here, and this is just a little bit more to kind of underscore these points. So this is from a LAO report. The LAO is the Legislative Analyst's Office. So the legislature has like completely neutral third party. They're real egghead types, brainiacs, academics, scientists. They really look at issues from a completely dispassionate point of view. So this is from one of their reports. So if something comes from the LAO, it kind of has the gold standard of it's without bias. It is just simply facts and numbers. So from that report, we see that, we'll just kind of read through the bullet points here. Poverty and economic stressors create conditions in which child maltreatment is more likely to occur. When state spending on public benefit program goes up, rates of child maltreatment go down. So that's a really key point, very interesting point. And we'll kind of talk a little bit more about that as we go. So that's where sort of CalWORKs comes in terms of a support program helping to reduce the rate of child maltreatment. So families living below the poverty line are 3 times more likely to experience child maltreatment. Black, Indigenous, and families of color are disproportionately more likely to experience sustained poverty due to systemic conditions. So again, this is all from the LAO. This is not me speaking. So the LAO as well reports that, here's a little bit more information actually. So high poverty rates are more likely to be eligible and more likely, so those places and people experiencing poverty are more likely to be eligible and more likely to enroll in CalWORKs. Approximately 60% of those eligible actually do enroll in the CalWORKs. And access to economic and concrete support is associated with decreased child welfare involvement. So I'm going to say that point again. I think that's a key takeaway. Access to economic and concrete support is associated with decreased child welfare involvement. Let's go on to the next slide. So this slide is a little bit of a visual representation of some of what we've been talking about here in terms of disproportionality. So you'll see this is kind of a visual scale of more likely versus less likely to have child welfare involvement. In this case, it's placement in foster care. So you'll see that Black, Latino, and Native American are on the more likely side of that scale, more likely to have a placement in foster care. Okay, so let's go ahead and go on to the next slide. So here's where we start talking a little bit about solutions. So Linkages 2.0 and the prevention framework can help address this problem by linking families to concrete supports and relevant services without involvement of the child welfare system. So the idea here is nipping in the bud, addressing this issue before child welfare involvement. So we think of CalWORKs as a child maltreatment prevention program because there's significant evidence that policies that provide concrete supports and income to families decrease the incidence of child maltreatment. The next slide, we'll go over some more examples here. Let's go on to the next slide. This is from a kind of a large scale report. So mothers who participate in TANF, so TANF is the federal funding stream, temporary assistance for needy families. TANF is what we use in California to fund the CalWORKs program. So they're sort of synonymous, but this is kind of looking at it from a national scale. So the reference point is TANF. So mothers who participate in TANF are eligible to receive full child support for their children. Child support is disregarded in determining welfare benefits. So mothers who participate in TANF and are eligible. So of those mothers who receive their full child support, they're 10% less likely to have a child with a screened-in maltreatment report. Second click here, this blue bar. This is an analysis from the National Academy of Sciences. So it's a consensus report from 2019, a roadmap to reducing child poverty, simulating the effects of increased income on CPS involvement for 3 anti-poverty policy changes. So again, you know, we got a bunch of eggheads together, getting together, making a report, but those guys are good usually. So expansion of EITC and child independent care tax credit, plus universal monthly child allowance, expansion of EITC, the tax credit I just mentioned, kind of short version is CDCTC, housing choice voucher program, and SNAP. Expansion of those and increase in the federal minimum wage to $10.25 an hour, plus a monthly child allowance. The analysis found that these packages have the potential to reduce CPS investigations by in a range from 11 to 20%. So, you know, you're talking about hundreds of thousands of children here when you're talking about those types of percentages. So reductions were particularly large for Black and Latinx children and those living with single parents. Results suggested a substantial reduction in racial disproportionality and CPS involvement. So a 19 to 29% reduction in investigations for Black children, 13 to 24% reduction in investigations for Latinx children, a 7 to 13% reduction in investigations for white children. And there's another study, Clevens, K-L-E-V-E-N-S, 2016, anybody's interested in looking it up, showed that implementing paid family leave decreased instances of abusive head trauma in California. So let's go to the third click here, the last little gray bar. Excuse me. Got off the slides here. There we go. So the third click, this is an example from Vermont. Vermont has the highest rate of child maltreatment referrals in the nation, but the lowest reported screened-in neglect rate, only 1.5%. So Vermont has created an economic firewall through interagency collaboration and service coordination. In Vermont, CPS is co-located with Economic Services Division and Early Child Development Division, providing all CPS district directors with access to family preservation flexible funds to prevent removal. To prevent removal of children from the home. They have multi-dimensional diversion system that refers families to economic support services such as TANF. California, that would be CalWORKs for us, family resource centers, and differential response systems. And just to kind of further keep going along this point, that families can reunify faster with cash assistance. In California, we are aware of this, and we've been working to make some changes regarding child support and continuing cash aid during reunification. That's AB 135 for any of you who are aware of that. We're in the process of getting that fully implemented now. So the evidence shows that income reductions are associated with a longer time to reunify. Children in foster care take longer to reunify with their families when their families lose a significant amount of cash assistance post-placement. The percentage of children remaining in foster care a year after, or after a year whose mothers lost a significant amount of income from cash assistance post-placement is more than double that of children whose mothers did not lose income from cash assistance post-placement. Let me say that a little more clearly so that back to AB 135. So historically, the way it's worked is CalWORKs part of the eligibility rules for CalWORKs is you have a child. So when the child is removed, cash assistance to the parents is removed. And so the point I'm trying to make here, and so AB 135 is a new law in California that continues to provide cash aid to the adults during the reunification process. And for these reasons, that the evidence is clear that when you just make things more difficult for families who are trying to reunify, to cut off cash aid for the parent or the parents who are attempting to reunify, it makes it more difficult. Children end up in a placement longer.
Excuse me,
Yes.
Damien. So we have a question. This is from Patty Ramirez. She's asking if allowing TANF recipients to also receive their child support, does that mean it is being exempt or still being used to calculate the MAP?
I would have to circle back on that one. So in terms, eligibility is a little bit less my area, exactly how those calculations work with keeping the child support. You know, you can buy back months with child support, sometimes, you know, months of cash aid, that kind of thing. So let me see if I can get a little bit better answer for you, and if I can get it before the end of the presentation, I'll load it in the chat.
And Andrea Lewis says she'd like to answer. So.
Oh, okay, we'll go.
Go, Andrea.
I went ahead and dropped the answer in the.
On the phone.
I went ahead and dropped the answer in the chat. The rules for CalWORKs did change. So if you decide that you want to just get your child support, then yes, it will be accounted. If you decide that you want to still have that child aided, because a lot of times it'll kick that child off. If you decide that you still want to be aided or that child, then we're back at the $50 disregard. So I would like to say yes, it is still counted.
Okay.
But there's a
Awesome.
lot of eligibility things that go into that, Damien. You are correct.
Yeah. Okay, well, thank you, Andrea. So let's go ahead and bump over to the next slide. And I think we can say here, oh, actually one back, the big one. Look at this. This is really the point that I'm just kind of hoping to drive home here, is that income matters. You know, we saw evidence in the previous slides that poverty, stress, result in increased instances of child maltreatment, involvement with the child welfare system. Income supports, material income supports, concrete income supports can help resolve those issues, and while at the same time helping to reduce some of those disproportionalities that we saw. Let's go to the next slide. And this is my final slide for today. And I'll kind of hit you with a little bit of additional numbers to kind of further emphasize this point that income matters. So each additional $1,000 that states spend annually on public benefit programs per person living in poverty is associated with a 7.7% reduction in child fatalities due to maltreatment. So that's pretty powerful. Independent of federal spending. Well, let me break down those numbers a little bit more. So for each additional $1,000 the state spends annually on public benefit programs per person living in poverty, we see a 7.7% reduction in fatalities, a 4.3% reduction in child maltreatment reports, a 4% reduction in substantiated child maltreatment, a 2.1% reduction in foster care placements, a 7.7% reduction in child fatalities. I've said that, sorry. When we're talking about this $1,000 here, just as informational for everybody, the programs that we're talking about is cash, housing, in-kind assistance, child care assistance, refundable EITC, medical assistance like Medicaid and CHIP. So that was the end of my few slides here. Happy to take any other questions folks have, but you know, again, I think sort of the takeaway here is that there is a connection, and the work that we're doing here with linkages to sort of leverage CalWORKs as a prevention component, and the prevention piece of this puzzle is important. it works. The numbers bear it out. So with that, I'll transition over to Juliet, who's gonna continue to sort of tell us more.
I'm going to tell you a lot more
Tell
about.
us a lot more.
Yeah.
We do have a question in the
Yeah.
chat.
Yeah,
Please.
okay.
Brian Simpson asks, can you share the data and source for what you just quoted? Because that is super powerful stuff.
I sure can. So that last slide comes from, let's see. Well, I'll put it in the chat.
Great, thank you.
Okay.
Thanks for that, Damien. I think before I talk, so I'm going to do a little bit more about the discussion about, so Damien really set it up beautifully to talk about how every dollar invested in poverty, anti-poverty programs, CalWORKs specifically, but anti-poverty programs reduces the indication that children will be reported to child welfare services. And that's really isn't that what this whole prevention conference is all about? What the whole statewide prevention effort is about? It's about strengthening families. It's about keeping families from getting referred. It's certainly about keeping children from being removed. So I want to talk a little bit about how vitally important it is that the CalWORKs program, and Linkages specifically, but the CalWORKs program is involved in your comprehensive prevention planning effort. And so I'm going to launch a poll here real quick to see if I can get an idea of how involved, if you know, your CalWORKs program is in your comprehensive prevention planning program efforts in your county. So if you can answer this question, I hope folks can see it. Great, I see the numbers still going up. And if you don't know, unsure is okay. So all right, great. I'm going to go ahead and end the poll and show you the results. So what you're going to see, hopefully you can see the results right now, is 33% of the folks who are here responded that CalWORKs is a active participant in their comprehensive prevention program or planning efforts at the local level. Fabulous, right? That it's so critical. Those that are unsure, my hope is yes. My hope is yes, that they are a planning partner. Those that are saying no, so we have 14% that are saying CalWORKs really isn't part of our comprehensive prevention planning efforts. They really, really should be. As Damien was showing you, and it's just so critical that your concrete supports, your economic supports for families are a vital piece of how you keep families strengthened and how you strengthen your comprehensive prevention planning network of programs throughout your county, CalWORKs being at the center of that. So I'm going to move on then and talk a little bit about Linkages 2.0 and how it fits into how Linkages specifically fits into the framework of prevention. The prevention, are folks familiar with the prevention, the 3 levels of child abuse prevention? If you're part of comprehensive prevention planning efforts, you've probably seen this quite a bit, but we really divide prevention into 3 levels, right? Primary prevention, which is those activities that are geared toward the whole general population, right? So anti-smoking campaigns, the kinds of things that public health does a lot of work in, right? To really start making sure that there's education out there for how folks can remain safe, remain healthy, right? So those are called primary prevention programs. Secondary prevention are those activities where there's a little bit more, there's maybe some risk factors involved, maybe some struggles that are involved. So we're going to intervene because we know some things, people are struggling with certain things. So we're coming after, I mean, excuse me, I'm moving the slides accidentally because I'm on the wrong screen. We're increasing the accessibility of resources. So family resource centers, for example, that offer information and referral services to families who are living in low-income areas, parent education programs that are put in strategic locations, home visiting programs, right, for mothers and families to help them with their newborn children. So these are some secondary strategies that occur, right? And then there's tertiary prevention, which is those kinds of services that are provided when something has already occurred, right? To prevent recurrence of issues. So the things that happen, an example in child welfare services, when they're doing family reunification services, when they're providing services to a family to help them reunify, right? So the children have been removed. Permanency planning for children who cannot return home safely. Parent support groups, the kinds of things that happen that child welfare intervenes in, those are usually called tertiary programs, right? So there's primary, there's secondary, there's tertiary programs, tertiary prevention. Let's think about how linkages fits into that framework. So that was what that last slide said. Now let's see how linkages fits in with this framework. So again, we were talking about primary prevention is our programs targeted at an entire population, right? To support and provide education before anything actually occurs. So what does that look like when you're talking about linkages, right? What does that look like in CalWORKs? Well, that might be support information that are provided to families who are on CalWORKs, right? So, hey, family, you're receiving CalWORKs benefits. Here's some supportive resources in your community. I don't know if you've looked into them. Not saying that you need them, but hey, here's some things that might be helpful to provide to you. So, family support resources that are given. The information is given to the CalWORKs families. And also just the fact that there's access to services, right? That's a primary prevention tactic. A lot of times we hear about in neighborhoods, there's nothing available, right? So there's a lot of differences between neighborhoods and communities around California. But having easy access to the services and resources that you need in your communities is also a primary prevention tactic. So secondary prevention and also early intervention, sometimes it's called both things. Again, those are the programs that are targeted to families in need to alleviate identified problems and prevent escalation. So something has occurred, we want to make sure that things don't run off the rails, right? So what are we going to do? We're going to intervene and provide some upfront resources to families. So what does that look like in practice? Well, that's kind of where child welfare emergency response and CalWORKs service coordination would come in, right? So there's a family there's a referral that's coming in, and this worker is saying, this family needs some economic supports.
Well,
I'm gonna refer this over. I'm
Someone
gonna
put in the chat on
mute somebody. I'm gonna refer this over to my partners over in CalWORKs because this family could benefit from some economic supports, right? So it's that kind of upfront coordination of services. Also, the family stabilization and home visiting programs that are going on in CalWORKs programs. These families there are families that have young children. There are families that are having having barriers to being able to work. They're having stressors in their families, and family stabilization is there for some of those welfare to work program participants to provide some supports and resources around that family so that they can participate and become self-sufficient. And then child welfare differential response. So this would be, child welfare referrals that come in where they don't really meet the criteria for being child welfare and for child welfare being involved, but they're saying, hey, this family could benefit from community resources. We have contracts with these organizations. We're going to refer these families out into the community to get what they need. We're going to hook them up with what they need. And realistically, differential response is kind of just a precursor to what we were wanting to see happen, which are community pathways, right? So community pathways, whether they're the FFPS defined community pathways that we're trying to build, or they're just the community resources that are available to folks locally that they can have access to provide the whatever supports and resources and strengthen that they need for their family. Those are secondary prevention, early intervention kinds of strategies that would keep families from escalating. And then lastly, tertiary prevention. What does this look like in practice? Again, said it before, this is more the coordinated case planning. Linkages 1.0, really strong in this area. This is the piece where you have Deanna was talking about it earlier. You have a family that's open to the child welfare system. You have a family in active, either in family maintenance or in family reunification, but they're in an open case. And that child welfare worker is actively working with CalWORKs to coordinate that case planning instead of saying, hey, family, do this plan to get work ready and do this plan to get your kids back. And those things, by the way, are at odds with one another, right? So this whole idea of working together, finding a way to coordinate that case plan and to help those families to be successful as a tertiary prevention strategy, and something the Linkages counties have been doing for nearly 20 years now, which is fabulous. All right. So that, and I already mentioned this, either family reunification or family maintenance cases. Hello. Okay, so I think I got to the right one. Yeah. So, okay, so Linkages 2.0. We've been talking about Linkages 2.0. Dana teed it up when we were able to get more funding to relaunch Linkages, and there were, I want to say, there were a number of counties who, even when the funding dried up, realized it was hugely beneficial to continue this program, and they continue doing Linkages irrespective of being funded, because they know it's the right way to do the work, to coordinate child welfare and CalWORKs work. But when the reinvestment happened, it provided an opportunity to bring all the counties to the table, right? So we're really wanting to make Linkages a statewide program and ensure that everyone knows about it and finds ways to access Linkages for their counties and for the families that they're serving. And one of the great ways to do that is to think about it through the lens of prevention, right? Counties are spending lots of time, investment, money in like looking into how they can expand their prevention services locally, right? So why not look at using your Linkages program, or bringing on a Linkages program and focusing on prevention efforts, right? How do you use that program to expand your prevention efforts? So we have a Linkages in our Linkages 2.0 relaunch. We have one of the committees, Dana mentioned it earlier, the Prevention and Early Intervention Committee. And I'm very happy to be a part of that committee. And we've been strategizing on ways that we could start getting primary prevention out there to our CalWORKs families. Again, go back to that. It's getting information out to the general population to just let them know about things that could potentially help them, educate them, empower them to seek out whatever they might need on their own, right? So one of the things we've designed is this brochure. And folks are probably quite familiar with protective factors. This brochure talks about the protective factors that strengthen families. And what's great about this is we've built this brochure in partnership with CDSS, which is fabulous. And it is a brochure that can be customized by the county. So it'll be a resource that's going to be provided out to counties where they can have this template, and this template will be, a county can utilize it, and they can utilize it for, I want to basically put this in one of my district offices, and I want to say, these are all the different supportive services that are available in this zip code, for example, that for all these different community-based resources that can assist with building protective factors. Could also be utilized potentially when I'm working directly one-on-one with a family and they want to know more about, I'm having issues on A, B, or C. I would really like to learn more about, how I can strengthen my parenting. I'd really like to know more about how I can get connected to my community. Like, what are the things that are available and around here that my family could take part in? Social connections is definitely one of the 5 protective factors. So this could be utilized in a one-on-one. So someone could fill it out and say, I think you'd really benefit from this, and I'm going to circle this and I'm going to hand it to you. So there's a lot of ways this could be used as both a primary and a secondary strategy. We've designed it as more in the primary area, but what's great about it is it'll be this customizable brochure that'll go out via an ACIN, and we're assured very soon from CDSS, which I'm really excited about. So we'll be able to send this out, and then counties will be able to utilize it. And they can print it, they can email it, it'll be available on their phones, those kinds of things. So here's an example. We actually worked to put an example together where one of the district offices for Los Angeles was interested in, showcasing how this might be utilized in their area. And so they gave me their resource directory and said, hey, these are the different resources we have that are really working on social and emotional competence of children. So I'm gonna have to ask that people mute themselves. Okay, thank you. So we went ahead and added these in there. So you can see it's a customizable field. Someone can enter this information and then they can, again, print it. They can send it out with their mailings out to their CalWORKs clients, put it in their, maybe put it in the schools, put it in doctor's offices. There's lots of ways where this information could be out there. So it's, you know, while we're specifically saying, you know, we're going to provide this to CalWORKs, we're not saying you have to limit it to that. It just has to be in your CalWORKs offices. You could utilize this anywhere in your prevention network, right? So this is just a helpful resource. It's one of the things that the committee has been working. And why have we been working on it? Because we've established what we call a theory of change. We believe that if CalWORKs staff provide child abuse prevention information to CalWORKs recipients and the families receive services to address maybe what potential barriers are in their lives, then families will have the support with parenting skills, financial stability, housing stability, resiliency, and child and family well-being. And as a result, families will provide safe, stable, nurturing relationships and environments for their children, and there will be fewer referrals of CalWORKs families to child welfare. So the theory of change is we put primary prevention strategies in place for this population, and you will see less families getting referred to the child welfare system. We have a secondary prevention theory of change too. If CalWORKs, child welfare, family stabilization, kinship navigators, differential response programs, if they all work together, and this is the whole idea of a community pathway, right? If they all work together to coordinate services, then families will have those increased supports for parenting skills, all the things we just talked about: financial stability, housing stability, resiliency, and child and family well-being. And again, they will provide those safe, stable, nurturing relationships and environments for their children, and it will be a decrease in re-referrals, right? So we're talking about this is secondary. You get that referral, you get the families connected to the resources and supports that they need, and you add that concrete support, such a critical piece of this, and there will be a decrease in re-referrals to child welfare and a decrease in the likelihood of entering foster care. And of course, tertiary, this is again why it's so important, why linkages is an important piece. Parents' welfare to work programs, child welfare case plans get coordinated, right? And families receive the resources and services leveraged by CalWORKs and child welfare together to address their barriers, right? Their barriers to child safety and family stability. Child safety, family well-being, and family self-sufficiency are shared responsibilities. They receive culturally appropriate services from staff who are cultural and trauma informed. So all the things that we're hoping that if you're involved in the formal system, that you're receiving the kinds of services that your family needs in a culturally and trauma-based, trauma-informed system. Then families will experience more stability with the provision of services. They'll be more likely to engage and complete their case plans, right? And have increased capacity to recover and heal from multi-generational historical trauma. And again, they will be able to provide a safe, stable, nurturing relationships and environments for their children. And there will be a decrease of a likelihood of children entering foster care. Like, so families who are in family maintenance and children are able to stay at home, it'll be a decreased number of those who are getting removed, right? And this tertiary, if linkages and we're coordinating all of this case planning, there'll be a decrease in time to reunification. So for those families that the kids have been removed, it lowers the amount of time for those kids to be able to go home. Hear Damien talk about it, right? About how much longer the time is for kids to reunify when you take their money away from them, right? And they have to be fighting that battle of economic instability, right? And how do I do anything else when I can't, I can't put food on the table, I can't pay my rent.
Julia, we have we have a question in the chat.
Yeah, please.
So let me I just moved. Oh, Andrea just answered it, but I'll just share with, so many of our families struggle with and have asked for after-school activities for their children, tutoring and childcare. Are these options available through linkages? And Andrea did respond. Community schools and childcare through CalWORKs can help with these. It's the network collaboration needed so that us as workers know where to refer our families for the resources they need.
Thanks for putting that there, Andrea. Thanks for lifting that up, Barb. I appreciate that. And just to put a pin on the end of this is Again, Damien talked about what we have all seen before is the disproportionate number of Black and Indigenous families living in poverty, being referred to child welfare services. It's if we put in tertiary prevention strategies for these families, we know we will have reduced disproportionate impacts for children of color. So that's a reason that we do this work, right? That's why we believe that these investments in primary, secondary, and tertiary strategies to help families through the Linkages program will absolutely increase better outcomes for our families. So thanks for letting me drone on for a little bit. I'm going to pass it back to, I think it's Andrea. Are you going to lead us through this conversation, Andrea?
Yes, I'm going to lead us through this conversation.
All right,
you,
thanks.
Juliet. You always make me smile. Your energy when you talk about linkages, early intervention, and prevention is, oh my goodness. I just keep talking, Juliet, keep talking. So Damien and Juliet shared some heavy things. I want us to take some time out for us to just share our thoughts. What is the one thing that you heard today that you can possibly add to your county's action plan for your CPP implementation? And just drop it in the chat and just share a little bit. And then while we're getting our thoughts together and sharing in chat, I just want to go back to that question from Patty. It looks like Kelly actually gave some additional information. That is the whole premises for me thinking of CalWORKs as a prevention or early intervention program. Most of our families come in to CalWORKs asking for help, not just the cash assistance or the CalFresh food assistance or even the Medi-Cal, but additional help, like what Patty said. And if we don't educate ourselves as workers about what we have available in the community, building and utilizing those community pathways, whether they're a part of our plan or whether they're on the outside, just a nonprofit helping the community, we always want to make sure that we know what resources we can refer to our families. It's meeting our families where they are and building them up from there. That's the goal that we have. And I do see some different things being dropped in the chat. So the importance of a robust linkages program. That's the one thing that Lorena heard today. Thank you, Lorena, for sharing. Sabrina is sharing an action step that she will take is to set up ongoing check-ins with the CalWORKs team. Excellent. That communication by itself, those check-ins let people know, oh my gosh, this is on the radar. And when we know things are on the radar, guess what happens? Stuff happens, right? Did anyone else want to share the one thing that they heard? Deborah, is this Contra Costa County? Very strong linkages program, doing so much of what was discussed today already and can only make it stronger. The minus is not all parts of the county have a strong of a connection with the CalWORKs and linkages teams. You're right. When I worked what I call in the trenches, when I worked in my county, we used to do road shows to different community-based organizations, whether they were within the county or whether they were outside of the county, just so that everyone was in that collaboration communication. And then the networking started coming across the board. Opportunities. Thank you, Tuolumne. Opportunities to coordinate services with CalWORKs and Child Welfare. Looking forward to the brochure as well as incorporating that in prevention and secondary intervention services. Yes. Patty is saying working more closely with county linkages team and having more intentional conversations. Excellent. Colleen from Humboldt is saying coordinating service provisions. Thank you all. For those that did share, please continue to share if there's something that comes across. Oh, I see it coming in. Thank you. Derek, welcome. Localized training on the nuances of CalWORKs, so social workers that families are referred to can also support them in navigating challenges based with different county requirements of CalWORKs. Good. for San Francisco to begin the communication between their FSPSA implementation committee and Linkages committee. Good.
Yay.
In LA, we looked at Linkages families who also received family preservation and found that successful completion of family preservation was associated with a decreased likelihood of a re-report. Excellent. If anyone wants to look into it, James dropped a link. Thank you, James. And of course, Dana, spreading linkages so that all families in your county can have access to the coordination that happens when you're a part of Linkages.
Absolutely.
Excellent. We're going to go to the next slide, and I am going to share with you all a video that was created in Riverside County. I swear this video works. It was created in Riverside County, and we consider it to be a success story from a Linkages family. And it should populate.
When I click it, I'm sorry, it tells me, hold on. I'll try again. My apologies, folks. It always works when Mia's here, but we have Mia in the main room. Okay.
That's what I was going to say. It worked in our pre-run, but then we had Mia,
Right?
so.
Oh, no. Let's see. Oh, here, maybe I can just open a YouTube and play it from there. Hold on.
That was, I was gonna say, yeah, just,
Yeah, I'll just paste it into my browser and see if I can do it
Yes.
that way.
yes.
It should come
And
right up
make
for
sure
you.
that your, video and audio is maximized when you share your screen, so you'll hear.
Yeah, thank you.
As Juliet is preparing the video, if anyone has any questions that they would like to ask regarding the presentation today, please go ahead and start dropping those into the chat or
Andrea,
Q&A.
I had a question about linkages and youth transitioning from foster care.
So that's, we do have a transitional aged youth committee with CDSS and also one within CFPIC. It's something that we're beginning to build towards. Currently, we've, as you know, with Linkages 1.0, we more focused on the tertiary, which were families that were already involved with child welfare system. Now we're moving into that prevention piece, and we're realizing that we also want that warm handoff collaboration network to happen with the former foster youth or the non-minor dependents as they're transitioning into adulthood.
And I see in the chat, Ventura dropped something in there. They're working towards a pilot to co-locate CalWORKs staff with their prevention school-based social workers. That's fabulous. And partners are eager to join these targeted prevention efforts and to our most vulnerable children in those communities. That's fabulous. Oh, here, we've got it up. Here
We do
go.
have one other question from
Okay.
Patty Ramirez. When coordinating case management, how do CalWORKs and Child Welfare combine the case plan so families are not feeling like they have to prioritize?
That,
And we can,
can I answer this? That
oh,
was
please.
that was the main, that was one of the main focuses of Linkages 1.0 was looking at a coordinated case plan. And we created, and it's on our website as well, a sort of a coordinated case planning guidance document. And Andre, I don't know if you can get to it, you can grab it and drop it in the chat, but it also went out through an ACIN. So counties do it differently. I'll let you know. They do it differently depending upon the counties, but the important thing that they do is make sure that they have included the welfare to work services if they need those services for reunification, which often they do, into the child welfare case plan. And then the monitoring goes between the two workers, the CalWORKs worker and the child welfare worker, that sort of monitoring. There's different ways that they monitor those activities in the plan. I see Patty raising her hand.
Yeah, just to go further into my question, Dana, it's like, family, we hear this from families that come into child welfare a lot. It's like, I'm having to make a tough decision between keeping my job or working part-time so I could get reunified with my children, but then all the activities that I have to do for the case plans that I have everywhere gets in the way of me maintaining a job for me to eventually get my, so how do we lower that stress for families that we create as part of the, different systems having different rules and requirements?
Well, my experience and what I've heard from the counties is that because the child welfare in law would take precedent over the welfare to work plan, that those are sort of in suspension in some ways during this time period where that they're trying to reunify, so that the welfare to work plan, the child welfare plan stands for the welfare to work plan, and their job is to really just support or to focus on that child welfare plan while that one's sort of sitting back there waiting. And of course, the services, any of the services under the welfare to work plan can be leveraged so that they still have those services, but they don't have to participate in some of those things like job shadowing or that, because that would be sort of sitting and waiting, if you will. And that's how they usually use it, so that it's not, they shouldn't have, the whole idea for Linkages 1.0 when it started is to reduce the redundancy, if you will. They should not have to focus on 2 case plans. They needed to focus on one, and that's why the child welfare case plan takes precedence with the supportive stuff from the CalWORKs welfare to work plan. I don't know if that answers Patty. But we're more than happy. Patty, where are you from anyway? What county?
Santa Clara County, and it kind of does answer the question. I think it's more related to, the families when in child welfare having to make the difficult choices of, do I work or do I do all these services that are court ordered?
Right.
And if I do all these court ordered services, then I don't have time to work. And
Right.
then that puts me in a bind, kind of situation.
Yeah. Well, that is, something at Linkages that we can't, the fact that there has to be a case plan to rectify or ameliorate any of the issues or concerns that were brought to the agency, and while they filed a petition. That's one of the reasons why, quite frankly, we really are focusing on prevention and early intervention, because we think once they get into the child welfare system, it's very tough. So that's why Linkages 2.0 really has a strong focus on prevention and early intervention activities. We got the video to go.
I think I'm gonna, can I give it a try and see if it'll work?
Yep.
Okay, I'm gonna give it a try. I'm gonna hit share sound. I think that's the way you get people to hear what's on my computer. Let's try. If you can't hear it, let me know right away.
I was married for about 10 years.
Good.
The abuse that happened between my husband and I, it started off as just like, cussing, throwing things. But throughout our marriage, it got worse and worse. It got to the point where my oldest daughter saw me get punched a bunch of times in the face. I went to a women's shelter, and basically they expect you to kind of get yourself together, and you're removed from the shelter after 60 days. They took me to a hotel, gave me 3 days, and they're like, you're on your own. After the second day, I called my husband, and I told him, I was like, hey, pick me up. I have nowhere to go. It messes up with your confidence, your self-esteem. Other people that are happily married and they have a husband that supports them, I'm wondering what's wrong with me? What did I do? After I went back with my husband, the abuse continued, and I basically saw in my bank statements that he was taking money. And I remember telling him hey, thousands of dollars are going out, and where is it going to? He proceeded to hit me, become physical with me. I left, and then I was able to call the police. The police got involved. They gave me a restrainer. They said, you got to stay away from this man. And then a few days later, CPS came to my door. They're like, we're aware of what happened. We know what happened. We know your husband hit you, and we know that your daughter was there. To be, at a place where I'm struggling to find a place to stay, it doesn't feel good, It makes me wonder what could I have done better? It's not. My social worker had told me about the Linkages program, and he said, I'm going to send out a referral. You don't have to do anything. You're going to get a call back. And I did. I got a call back, I remember, within a few days. With the Linkages program, it was really good because I had my own social worker. She would call me. She's like, hey, what are you doing? How are you? And it made me feel like a human. I felt like, wow, someone really cares for me. Even though that I know that's her job, but it made me feel really good. And I felt like, you know what, maybe I could do this. You know, I'm like, this lady doesn't know me and she believes in me. You know, she must see something that I can't see in myself. She already knew everything about my case. My CalWORKs application had got denied, and it was my Linkages worker who got it approved for me. She helped me look for childcare, food stamps for the girls, medical. It was a complete service, you know, everything. My CPS worker had told me that there was a program that they will pay for housing. When me and my Linkages worker, we spoke, like I told her, like I definitely wanted to submit an application for that and like what were the steps. So we started working on that, and one of the things I remember her telling me was you need to find a place on your own. So you need to work on your credit score and make sure you have a steady job. At that time, like I was doing the online school, like, you know, going to college online, and I started working Instacart, and I also cleaned houses. The Linkages program referred me with the Housing Authority, which has helped me pay for my deposit the first month, and then they continue to help the second month, the third month, and I believe the fourth month also. So me and my girls, we used to be homeless, and now we have a house. It feels really good. I'm a new person. I'm so confident now. Like I'm able to like just feel better about myself. Like I'm really proud of the things that I've done, and I could say like I did this, you know, like it was me, and I work really hard, and I come home and I'm like, this is my castle, you know. I open the door and I just like I could throw my purse on the couch and I'm like, this is mine. It feels so good to be able to work for something and just say like my girls are allowed to do whatever they want here, you know. This is home. It feels so good. Sure. Oh, wow. Thank you so much. Okay. Okay, go back in, okay? I'll see you in a little bit.
So that video gets me every single time, and I have watched it so many times because that's why we show up every day. That's why we do what we do. That's why we learn those resources. We provide that prevention piece, that early intervention piece, and we save each and every family one at a time. Ooh, deep for me. I shared the link in the chat as someone asked, and earlier in the comments, someone said, we can use our housing support program for early intervention. Yes, we can, 100%. Oh,
Okay, so
kinda
I
just
think
got me a
we're
little bit.
okay. I think we're ready to close, and we've been taking your questions, and you've been putting some in the chat. We haven't answered any of your question. If you have anything else, let us know. And we, you know, we're here. Myself, Dana Fabella at CFPIC.org, and Andrea Lewis at CFPIC.org. So if you have any specific questions, or you want to, you know, connect with us, if you're not sure that whether your county is part of the collaboration, I've heard from a couple counties weren't sure, and both of your counties are part of that collaborative, but it's very clear it needs to be spread a little more within the county. But we're excited, and I think you heard about you know, the work that we're doing to support and to move forward in the linkages to Linkage 2.0, a prevention strategy using that whole framework of primary, secondary, and tertiary. So we know that we focus on the tertiary and Linkages 1.0, which was the coordinated case planning after a child's already, you know, got a referral to child welfare, but now early intervention. At the hotline, you can have families refer to their CalWORKs worker to really support the family, or you might have family stabilization to help support the family. And of course, you know, that whole prevention idea, working with our working at the very front end, as you know, Juliet talked about some of the strategies that we've been thinking about and working on, including the brochure, which we hope after this you'll be wanting to use in your county as well. So unless there's any questions in the chat that we haven't answered, I don't see anything.
I think we're good. If
I
there
think
was
you're good.
something that we missed, please let us know.
No, I think you're
Yeah,
good.
reach out.
And James put, I like this link by Dr. DeAndrade, Amy DeAndrade, who helped us do some evaluation actually with Linkages 1.0. And so there's a link in there for your pleasure.
And I think we're going to put in the Dana in the main lobby chat, or we're going to send out there's a Linkages conference coming up as well. And I think we're going to get that information out to folks. Lots to learn. So if folks are, Linkages counties are interested in what they can learn to become a Linkages county, I said, reach out to Dana, reach out to Andrea.
Yes, and we
Good
would love,
stuff.
yeah, we would love you to learn more. We've got like 15 different workshops going on and some good speakers for our Linkages convening, which is April 23rd through the 25th in Sacramento. And we're calling it Linkages Upstream because that's where we're trying to move, is upstream work. And for those of us, and I see many of the names that I know, quite a few of you been in child welfare a while, we know that the answer isn't in removing children. The answer is in supporting families. So,
Yep.
Okay.
Back to Barb. Barb, you're going to transition us, Barb, back to the main?
I will transition you back to the main. So we have a 10 from 1:50 till 2, we have a virtual closing. So if you would be kind enough to leave this session and then just join the main session again.
Yeah.
And that will be the end of our day together. And thank you so much. What a
Thank you.
wonderful,
Thank you
wonderful,
all.
informative session, and what
Thank
great
you.
information.
Excellent. Thanks for coming. We appreciate it.
Yes, it was great. I really enjoyed it. I'm going to make sure to save the chat too.
Yeah, oh, that's good. Thanks. Save the chat. I was going to do it and then I don't see it right now.
I know, I don't want to leave yet. Oh, it's
I
the
know,
3
that'd be
buttons.
And
There it is.
Once
Save
you're,
the
if
chat.
you're recording, the chat will
Yay.
save, just so you know.
Oh, I didn't know that.
But it's good to save it on the side anyway, so you don't have to go back and find it in the recording.
Oh, I didn't
Yeah.
realize that when
Yeah.
you're recording. Okay.
Thanks, everybody.
you.
We'll see you back in the main.
See you shortly. Bye now.